a different approach and looking at this much more generally in terms of disasters, of which pandemics, of course, are one, and looking at it from the point of view of aging. And I think the ethical issues that I would bring to your attention are the whole question of the elderly in these circumstances, and to see do they get a fair deal or not. And I think Sean's presentation shows that there seems to be a willingness, certainly amongst those admitted to hospital. I was surprised at that. So let me just...
The space bar will work.
Just looking at the various disasters that one sees, the natural ones, of course, we seem to be hearing on a day-to-day basis. Chemical ones, now again with trains being derailed and things, and nuclear, Chernobyl still has a great resonance in the problems that concerns caused, and we've had the talk about pandemics and the fact that this latest flu wasn't as bad, though 400 people died and they were younger. So though the main general public hasn't been affected, from a point of view that one expects a flu-like illness is just to have a mortality amongst the frailest and oldest or the very young. This was hitting people in their prime of their lives, so it could have been a very serious situation. Unfortunately, terrorism is a very real circumstance. On a day-to-day basis, we look at what's happening in Iraq and other places, and of course 9/11 still has an awful resonance. Just looking at some of them, of course, Haiti and now Chile are very evident as major issues, and still Hurricane Katrina, the results of that are still being worked through, and Pakistan and the tsunami, of course, and the European heat wave. And of course we do have heat waves on this side of the Atlantic, and the one in Chicago in the 90s was particularly bad. And a lot of the people who suffered in that were the elderly. And one of the major problems were that they were very isolated, and they were frightened to go out from their own buildings because security is such an issue there. So they literally roasted to death because they were fearful of leaving their apartments. Canada is not... we do get our own sort of disasters, including the floods in Manitoba and the Red River, which seem to occur yearly, but now and then are particularly bad. And the one in 1997, 28,000 people had to be evacuated, including some transfers from a hospital because they were fearful there. And the big concern there was of waterborne infections. And once you get a disaster, there are all sorts of ramifications which can cause difficulties, and that was one that was feared then, but didn't occur. Another problem was the ice storms, the major one in 1998. There was a very interesting report from Montreal General Hospital. Things were so bad that they actually set up space in the hospital so the staff could stay, because if they let them go, they weren't going to be able to get them back again, so they had to sort of pitch down. And of course there was a major increase in the number of fractures, and you had a lot of elderly people in particular. If they went out on the icy streets, they were at great risk for falling and fracturing various limbs. One of the interesting side effects was because all the power was out, people were using alternate means to try and keep warm, and there was a major increase in the numbers of carbon monoxide poisoning, and 700 cases were reported in Quebec, and in Ontario too, 28 cases in Kingston. And of course some facilities providing care, when the power went down and they had no backup generators, then people had to be evacuated. And you remember that the evacuations in Katrina, the major issues there, where people were abandoned in some long-term care facilities, and in other facilities, they all were relying on the same bus company to provide transportation, so that they were just overwhelmed. The SARS has already been mentioned here, and of course that was a disease which really was confined, fortunately, to healthcare workers and healthcare institutions, and it did lead though to 44 deaths, and I know some people here, including myself, were actually in hospitals during that period of time. And there was a lot of problems with the isolation of patients, which caused a lot of distress for people, since they couldn't be seen and no one could see them. And the closures of hospitals to admissions, the delay of treatments, the economic impact. The question of staff safety and support has been mentioned, the duty to care. And certainly the Campbell Commission showed that there had been a major problem as far as the nurses were concerned, that they had not received the support that they had needed, and indeed their concerns were overridden by the administration and some of the infectious disease people, when in fact the nurses were right and knew that the condition had recurred, but the experts said no. The duty to care, I think it's very interesting that this is a discussion now, and one of the things through CanPrep that we're looking at is a generational difference. Will the older healthcare workers have a different approach to this than a younger generation who may see working in the field now more as a job rather than as a vocation it may have been seen in the past? And I think there's, remember, in the immigration of Irish immigrants when they came to Toronto in the 1840s, the outbreak of cholera and typhoid and the numbers of deaths there, including amongst many of the people who went to their assistance, the people working at the port of Toronto, even the Catholic Archbishop of Toronto died in that. So it was a very different approach to the duty to care in those days. Well, certainly these disasters are occurring on unprecedented numbers, and I think on a daily basis we see that, just as if one disaster hits us and then another comes, as we've seen with Haiti and Chile. And there's a concern that climate change may lead to an increase in these. And these are just some figures from the tsunami about how many died then and the cost. And I think we'll have to wait and see what the cost is for Haiti and for Chile. But these are major economical issues. Now I want to look at this from the point of view of the elderly. And just some general comments that aging is not a disease, and that as people grow older, they become more diverse, not similar. And that aging is a worldwide phenomenon. In fact, it's occurring most rapidly in the third world countries, but it is something that seems to have been ignored by our politicians, and some of you may have seen a very good article by Andre Picard in the Global Mail a few weeks ago, looking at this and saying it's time that we woke up and address this issue and not to keep on fobbing it off. And we're seeing that other countries are just reading today that in Ireland the age of pension when you receive your pension is going to increase to the age of 68. That'll be phased in over a few years, and that's happening in other European countries.